You know, I've been doing a lot of thinking about being a hospice nurse and really loving what I do, and I find it just just a privilege to be there for families and patients who are at the end of their life, and trying to make their last days more comfortable and their families more educated on keeping them comfortable and not making them feel the fear of not knowing what's going on. Now, I was not able to do that for my mother or father. And my mother was taken from us too young. And I remember she died of a heart attack in somebody's home when she was at work. And I remember my father and I going down to the home to see her. And the police wouldn't let us in. And, as like a teenager, standing at the fence, helpless, not able to go in to see your mother who had passed away, just helpless. And the last vision of your mother is being taken out of a home in a body bag. Like, that never leaves you. Years later, my father lived to a good old age. He was a stubborn, toe tapping, smoking, drinking Irish man, and he lived a good long life. But and he was sick for a very long time. Um, he had kidney disease. He needed dialysis, and that's another story. Shouldn't have happened, but being a stubborn old Irishman, he didn't tell everybody he was urinating blood for months after. So, long story short, bladder cancer, needed his bladder taken out, urostomy, dialysis. The progression begins. He hated every minute of dialysis. Now, again, my sister and I were nurses. We were home care nurses. We had no idea of hospice nor end of life symptoms. And nobody actually told us about hospice or even recommended hospice. Now, this was back in, I don't know, like the mid 2000s. He had every end of life symptom that was there that I see with my patients now. And my sister and I agree. My sister now, interestingly enough, is a hospice nurse as well. So I think some of that experience put us in that direction. Now, couldn't do it for my mother. My father, we couldn't do it either because there was nobody home. My father needed 24/7 care. He had multiple hospitalizations for falls, fractures, aspiration pneumonia, went into rehabs, and then, after your days are up, if the goals are met or not, your goals are met. You're back home. So we tried that again for a little bit. Sooner or later, he was back in the hospital with aspiration pneumonia or something. Now, the hospital sent us home with home care because, again, my father did not have Medicaid. He had Medicare. This man worked all his life, and he did not die with dignity. That's kind of, ugh. I think we all deserve to die with dignity, and he did not. The hospital sent him home in a hospital bed with a bed alarm and Xanax. He was jumping out of bed. He was doing the reach. That's visioning, agitation, restlessness, everything that is an end-of-life symptom he had. And my sister and I, we did not pick up on it. We were losing our minds. And a home health aid service, we're going to give him 2 hours of home health aid 3 days a week. We couldn't do it. We didn't have the financial means to private hire. So my father had to go into a state hospital. He didn't have the best care. I'm sorry to say, he didn't. They were overworked, overwhelmed, understaffed, didn't have the best care. The doctor was just changing medications. Long story short, he developed pneumonia, went into the hospital, had to be transferred to an acute care hospital, and died of cardiac arrest. Got the call in the middle of the night. Per your DNA orders, your father passed away. It was still like a kick in the throat, even though you saw it coming. And I said, I'll be right there. I was there within a half hour. I wanted somebody that loved him to be the last person to see him. And I was there. I held his hand. I kissed his forehead. Said, thanks for everything. And I love you. And that was his story. And I know my story. There are many, many stories like that out in the world. So do I hope our medical system changes at some point? I do. I think everybody deserves care. I think everybody deserves to die with dignity and to stay home with their families if that's their wish. I couldn't provide it for my family. And to be able to do it, to be a hospice nurse so other families can do it. I don't feel resentful about it. I feel resentful that my father died the way he did. I don't feel resentful for caring for patients who want to stay at home. I feel like I'm doing like a mitzvah, like one of those Jewish, like paying a Torah type things. I feel good about doing that, and I think my dad would be proud about that. But for families out there, I get it. I do get it. And I just needed to get that out there. Because, again, as a hospice nurse, I was not able to have hospice service for my mother, obviously, or my father. So we just do the best we can. And those who cannot bring people onto hospice, I would say assisted living, lots and lots of money, nursing homes, get there when you're unexpected. So everybody's kind of on their toes. And, ask what is available to you. A closed mouth never gets fed. All right, that is my spiel for today, and we'll talk again soon.